Malignant melanoma is one of 3 types of skin cancer. Of the 3, it is the most dangerous. There is historical evidence of possible signs of melanoma dating back 2,400 years. In 1787, John Hunter became the first surgeon to operate on metastasized melanoma. In 1804, melanoma was first described as a disease during a lecture in Paris. Over 150 years later, Professor Henry Oliver Lancaster discovered that melanoma is directly related to exposure to the sun. Within the last 50 years, funding for research and treatments has increased. Currently, there is research studying the effects of vaccines, chemotherapies, immune stimulants, and virus treatments on melanoma. It is known that melanoma begins in the skin cells which produce melanin. These skin cells are called melanocytes. Too much exposure to UV rays can over time cause the melanocytes to mutate and grow abnormally. Our society puts a lot of emphasis on the fact that having tan skin is beautiful. This causes many people to subject their skin to unnecessary and dangerous UV rays by laying out in the sun or going to tanning beds. In recent years, there has been an increase in public education and the availability of screening clinics. This has helped to increase the awareness of both the causes of malignant melanoma and the ways to prevent it. This has been done to help combat this deadly disease. Now you might be wondering, what can I do? The best prevention for malignant melanoma is limiting your sun exposure and preventing sunburns. It is also important to know that your risk of getting malignant melanoma is increased if you have fair skin, have a history of sunburn, have had excessive UV light exposure, have a family history of melanoma, live close to the equator, have a weakened immune system, or live at a higher elevation. It is also important to know what signs to look for in moles. If you see these signs, it is important to visit a dermatologist. The signs to look for are asymmetrical shape, an irregular border, an uneven color, a diameter larger than 6 millimeters, about the size of a pencil eraser, or an evolving mole. When untreated, malignant melanoma can be carried by the lymphatic system to the regional nodes and/or into the bloodstream, allowing it to spread throughout the body. Malignant melanoma will commonly affect the lungs, the brain, the liver, and the bones. When the growth is uncontrolled, it compromises vital organ functions, leading to death. When malignant melanoma is discovered, the standard treatment is surgery, removing the tumor along with the skin around it and the fatty tissue beneath it. Immunotherapy can be used to stimulate the immune system and reduce the risk of the melanoma returning. Chemotherapy and radiotherapy are used if the cancer has spread to other parts of the body.